Good morning, doctors. I am Dr. Mohamed Mekky, Assistant Lecturer of Oral Maxillofacial Surgery. I am going to discuss with you the early signs and symptoms of head and neck cancer, which any dentist will face at least several times in his career, especially the dentists with high rate of patients. So, your rapid look for a patient and only consider the patient as a tooth, not a human being, will make you misdiagnose or skip the diagnosis of a lethal cancerous lesion. This will end with a patient with a disability, either aesthetically or functional, and even will end with a death. The following are the signs and symptoms of head and neck cancer. So the first of all, the common symptoms include sore mouth ulcers that don't heal within several weeks. It is recommended to take a biopsy from a lesion that don't disappear in maximum 2 weeks after removal of the cause, such as ill-fitting denture or sharp restoration or tooth cusp. Also, unexplained persistent lumps in the mouth that don't go away. It increases in size rapidly. It may be either small or a big in size, as shown in the first picture, a small lesion in the cheek, and in the second picture there is a large lesion from the alveolus. Also, it could be presented as a persistent lumps in the lymph nodes in the neck that don't go away and is not related to inflammatory etiology as ear, nose, throat infection as tonsillitis and common cold. Also, scalp infection as dandruff, dental infection, and sometimes they are abdominal cancer, and the metastatic lymph node is the left supraclavicular lymph node, and in this situation we call it Virchow's node, and you need to refer the patient to a general surgeon, as shown in the second picture. Cancer can be presented by pain during swallowing, or what we call odynophagia, or difficulty of swallowing. In other words, we call it dysphagia. Symptoms of dysphagia are choking while swallowing of food or drinks, coughing or vomiting of blood during or after swallowing, aspirating the food in the lungs, difficulty of chewing, trouble moving food to the back of the mouth, food sticking in your throat. We have many causes of odynophagia, ranging from neurologic disorder to cancerous condition, as shown in the second picture. Changes in your voice or difficulty in speech may be a symptom of cancer in head and neck region. Unintentional weight loss, or what we call cancer cachexia, which has 2 stages till we reach death. It is diagnosed by any of the following criteria. First, weight loss more than 5% in the prior 6 months, or weight loss more than or equal 2% with body mass index less than 20 kg per meter square, or weight loss more than or equal 2% with sarcopenia. And the meaning of sarcopenia is the atrophy of muscle mass with aging, as we see in the last picture. The last picture shows the top is the young muscle bulk with its histology, and the bottom is the old sarcopenic muscle bulk. Sarcopenia means loss of skeletal muscle mass and function, especially with aging, as you see the difference in the muscle mass and subsequently the muscle function. Bleeding, as the cancer needs new blood vessels to grow rapidly, but these vessels are not well formed and have fragile leaky walls, so the cancer bleeds easily. Numbness also, which is always a bad sign for cancer spread via the neural invasion. 1 or more teeth that becomes loose for no obvious reason, and that is a very important sign that is misdiagnosed by most of the dentists as a periodontal disease. So never ever extract a mobile tooth without a detailed history of the cause of mobility and x-ray to inspect the underlying bone resorption pattern. I know it is an easy money, but you are doing a crime if you extract such a tooth which is involved in the tumor. A very alarming sign is non-healing tooth socket after a tooth extraction. In such case, you only irrigate the socket with saline. Never try to curate the socket, just close follow-up. Gradual trismus till the inability to open the jaw completely which indicates tumor invading the masticator muscles. Red or white patches on oral mucosa, which are common and sometimes turn in cancer. The tongue on the left side was treated as a fungal infection for 6 months, in which the white red lesion turned to moderately differentiated squamous cell carcinoma, which needed a subtotal glossectomy and complicated reconstruction. The description of the malignant ulcer includes an everted edges as a squamous cell carcinoma or beaded edges as basal cell carcinoma, irregular margin, necrotic floor, and indurated base. The most famous example for induration is the insect bite that is firm and almost fixed to the underlying tissues. The clinical criteria of malignant lymph node include a lymph node of size more than 1 centimeter, consistency rubbery, firm, or hard, and fixed to the underlying tissues, persistent more than 2 weeks, and usually not tender. It means that it may be tender and malignant in the same time, especially at late stage of cancer. In these situations, you must refer the patient for a specialized maxillofacial surgeon. So you can educate your patient to self-examine him or herself for early detection of oral cancer by grabbing a bright light, a mirror, and say "ah" to these simple steps at least once a month. Here's how. Remove any dentures, look and feel inside the lips and the front of the gums. Pull the cheek out to see its inside surface as well as the back of the gums. Tilt your head back and inspect and feel the roof of your mouth. Pull out your tongue and look at all of its surfaces and the floor of the mouth, which are a site for high suspicion for malignancy. Feel for lumps or enlarged lymph nodes in both sides of the neck, including under the lower jaw. And to summarize, the most important red flags of the oral cancer are the following: unhealed ulcer after 2 weeks from removing the sharp edges or denture, and also for the site, inspect the floor of the mouth, sides or ventral surface of the tongue, and also very important that the fungal infection doesn't cause ulcers. So never ever to treat a patient for a long time with antifungals and say it is an ulcer, it is a fungal infection. Thank you for your attention.